In the case of the sleeve, the gastric bypass and gastric band, you will usually have 4 or 5 small keyhole incisions, which are typically between 5 and 15 millimeters long. There are typically 2 on either side of the abdomen and then 3 on the front of the abdomen, although this can vary between practices. In my practice, the wounds are closed using a combination of dissolvable sutures and skin glue, ensuring that you have the best chance of healing neatly. The incisions will be waterproof within 24 hours, allowing you to have a shower. I encourage patients to pat their wounds dry to stop them accidentally rubbing off the skin glue, which will naturally fall off by about 2 weeks after surgery. If you have had previous laparoscopic keyhole surgery to remove your gallbladder or previous weight loss surgery, for example, it is often possible to use at least some of the previous incisions. Of course, this may not always be possible, but if this is an important consideration for you, please make sure that you bring this point up with your surgeon. If surgery cannot be safely undertaken using a laparoscopic approach, perhaps due to severe adhesions or scarring, I would rather abandon the operation than convert to a large open incision. I often get asked about wound drains. My practice is not to need these routinely, whilst other surgeons may do so. So please make sure you speak to your surgeon about this beforehand. Similarly, if you have skin tattoos, it is worthwhile to speak to your surgeon about the placement of the incisions. Quite often these can be strategically placed to reduce the risk of interrupting tattoos.